My portion of this presentation is all about policy objectives, options, and alternatives. Current objectives and policies that affect nurse practitioners are geared towards the proponent of expanding the nurse practitioner's role or current legislative reform and payment reform. The IOM noted in a 2010 report, The Future of Nursing, Leading Change, Advancing Health, that state code of practice laws dictate the services that nurse practitioners are allowed to perform. The report recommended changes at the state and federal levels to allow nurse practitioners to practice to the full extent of their education. With regards to the payment reforms, the IOM recommended that Congress change the Medicare law to make coverage of nurse practitioners' services consistent with coverage of physician services. It further recommended that the Centers for Medicare and Medicaid Services clarify that hospitals participating in Medicare program must allow nurse practitioners to have clinical and admitting privileges and to be eligible to be on the medical staff. The IOM also endorsed the notion that the federal government should require plans participating in federal employee health benefits program to cover services provided by nurse practitioners operating within state laws. At present, one of the billing criteria with CMS is that services are paid only at 85% of the amount that a physician is paid under the Medicare Physician Fee Schedule. There is another option that emerges as model of primary care emphasize comprehensive, patient-centered care through structures such as patient-centered medical homes and accountable care organizations. These models focus on elements of care such as care coordination and health promotion that have been traditionally provided by nurses. Programs and funding authorized by the Affordable Care Act support a number of these emerging models, including nurse-led clinics. Nurse-led clinics may provide care in underserved areas or meet the standard for more convenient care by providing a limited number of low-intensity, commonly needed services in locations such as retail stores. In 2010, HRSA awarded $15 million for a small demonstration project that will support 10 nurse-managed clinics for 3 years. In addition, the health reform law included $30 million to cover educational expenses to train 600 nurse practitioners and a $200 million clinical training demonstration project designed to increase production of advanced practice nurses, including nurse practitioners. Searching for alternatives will focus on concerns about access to primary care services. This will continue to fuel the debate over the role of nursing in delivery of primary care. States will have the opportunity to consider the need for primary care practitioners as they implement provisions of Affordable Care Act. The National Conference of State Legislatures reports that as of February 2012, there are about 245 bills had been introduced in various state legislatures, and about 50 of these bills would affect nurses, including advanced practice nurses. In considering changes to licensure and scope of practice requirements, state legislatures will weigh concerns from physicians about patient safety and try to discern whether these concerns have any validity or primarily represent a concern about competition. They will also have a way we weighed the importance of the need to innovate with new healthcare delivery models to meet the demands for primary care to a growing and aging population, especially those in need of preventive services at one extreme and those suffering from multiple chronic diseases at the other.